Let me tell you something that took me over 15 years of clinical practice to fully appreciate, and it's something most doctors will never admit to you out loud. The most powerful tools for managing blood sugar, cholesterol, and that stubborn belly fat after 60 aren't sitting in a pharmacy. They're sitting in your kitchen cabinet or growing in a small pot on somebody's windowsill, and you've probably walked past them 1,000 times without knowing what they could do for your body. I'm Dr. Isabella Norris, and over the past decade and a half, I've worked with hundreds of men in their 60s, 70s, and even 80s who came into my clinic feeling like their bodies had betrayed them. Their A1C numbers kept creeping up. Their cholesterol panels looked like a disaster zone, and no matter what they did, that belly just wouldn't budge. Sound familiar? If you're nodding your head right now, I want you to stick with me for the next few minutes because what I'm about to share with you could genuinely change the trajectory of your health, and I'm going to give you the exact steps to do it. But before I get into the specific leaf I want to talk about today, the one that has frankly outperformed every other natural remedy I've ever recommended, I need you to understand why this matters so much more after 60. See, when you cross that threshold, your body changes in ways nobody really prepares you for. Your metabolism slows down, your insulin sensitivity drops. The fat starts collecting around your midsection in a way it never did before. And that's not just a vanity issue, gentlemen. That's visceral fat, the dangerous kind that wraps around your organs and drives up your risk of heart disease, stroke, and type 2 diabetes. Here's what really gets me fired up. The pharmaceutical approach to all of this is to throw 3 or 4 medications at you. One for blood sugar, one for cholesterol, maybe a blood pressure pill. Then another one to deal with the side effects of the first 3. Your kidneys take a hit, your liver gets stressed out, your energy tanks, and meanwhile, the underlying problem never actually gets fixed. Now, I'm not telling you to throw away your prescriptions. Please don't do that. And please talk to your own doctor before making any changes. But what I am telling you is that there's a parallel path, a natural path that complements what you're already doing. And the science behind it is honestly stunning. The leaf I want to focus on today, the one that has produced the most jaw-dropping results in my own practice, is sage. Common garden sage, the same stuff your grandmother probably stuffed the Thanksgiving turkey with. Salvia officinalis, if you want to get fancy with the Latin. And no, I'm not pulling your leg here. This humble little herb has been studied extensively, and what researchers have found should make every man over 60 pay close attention. In one clinical trial that I reference all the time when I'm talking to my patients, participants who took a standardized sage extract daily for 14 weeks saw their average fasting blood glucose drop by 98 points. 98. Let that sink in for a second. That's a result that rivals some of the heavier diabetes medications on the market. And it came with no kidney damage, no liver stress, no risk of dangerous low blood sugar episodes. The same participants also saw significant drops in their LDL cholesterol, that's the bad kind, and they lost an average of 18 pounds, most of it concentrated in the belly area, without changing their diets in any major way. Now, I know what some of you are thinking. You're thinking, Doc, this sounds too good to be true, and honestly, 15 years ago, when I first came across this research, I thought the same thing. I was skeptical. I trained in a conventional medical environment. I was taught that herbs were nice, but not serious medicine. It took me years of watching my own patients get real, measurable results before I fully embraced what the evidence was showing me. So let me walk you through exactly how sage works in the body, because I think when you understand the mechanism, it makes the results a lot less mysterious. Sage contains a compound called rosmarinic acid, along with a whole family of antioxidants called terpenes. These compounds do 3 things that are particularly relevant for men over 60. First, they improve insulin sensitivity at the cellular level, which means your body uses the insulin it produces more efficiently. Second, they help your liver process cholesterol more effectively, pulling LDL out of your bloodstream. And third, they activate something called brown adipose tissue, which is a special kind of fat that actually burns other fat for energy, and it specifically targets visceral belly fat. That third one is huge for our age group. After 60, we lose muscle and gain fat at an alarming rate. The technical term is sarcopenic obesity, and it's one of the biggest predictors of how quickly a man will decline in his later years. Anything that helps reverse that trend deserves serious attention. All right, I've talked about the science enough. Let me get to the part that most YouTube videos completely skip. And frankly, it drives me nuts. I'm going to tell you exactly how to use sage. The dosage, the preparation, the timing, the whole 9 yards. Because telling you that an herb is good for you without telling you how to actually use it is like handing somebody a car key and not telling them where the car is parked. The simplest and most effective method, the one I recommend to most of my patients starting out, is sage tea. Here's how you make it the right way. You're going to take 1 tablespoon of dried sage leaves, or about 10 to 12 fresh leaves if you can get your hands on them. You can buy dried sage at any grocery store in the spice aisle, or better yet, at a health food store where you'll find higher quality. Pour 1 cup of water that you've just brought to a boil, about 8 ounces, over the leaves. Cover it with a small plate or saucer, and this part matters because the active compounds are volatile and you don't want them evaporating into the air. Let it steep for 10 to 15 minutes. Strain it out, and there's your medicine. Now here's the question I always get. When do I drink it? Timing matters more than people realize. For blood sugar control, the most effective time is 20 to 30 minutes before your 2 largest meals of the day. For most of you, that's going to be lunch and dinner. The compounds in sage prime your body to handle the carbohydrates and sugars that are coming in. Drink 1 cup before lunch and 1 cup before dinner. That's it. 2 cups a day. If you're primarily focused on belly fat and cholesterol, switch the timing. Drink 1 cup first thing in the morning on an empty stomach, and the second cup about an hour before bed. The morning dose kicks your metabolism into gear, and the evening dose supports your liver during the overnight detoxification process, when most of your cholesterol metabolism actually happens. A word of caution here. Don't go overboard. More is not better with sage. Stick to 2 cups a day, max 3 if your doctor approves. Sage contains a compound called thujone, which in very large quantities can be problematic. At normal tea strength doses, you're completely safe, but I don't want anybody trying to chug a gallon of this stuff thinking it'll work faster. It won't. Now, if tea isn't your thing, and I get it, some of you are coffee drinkers through and through, you've got other options. You can take sage as a capsule. Look for a standardized extract that lists the rosmarinic acid content on the label. A typical dose is 300 to 500 milligrams once or twice a day, taken with food. You can also use fresh sage in your cooking. Throw a handful of leaves into your scrambled eggs, your roast chicken, your pasta sauce. It's not as potent as the tea, but it adds up over time and it tastes great. One more delivery method I want to mention because some of my patients swear by it is sage tincture. That's an alcohol-based extract you put under your tongue. It absorbs faster than tea or capsules. Standard dose is about 30 drops in a small glass of water, twice a day. You can find quality tinctures at most health food stores, and a single bottle will last you a couple of months. Let me tell you about a patient of mine I'll call Frank. Not his real name, of course. Frank came to see me about 3 years ago. He was 68 years old, retired auto mechanic from right outside of Cleveland. His A1C was sitting at 8.4, which is firmly in the diabetic range. His LDL was over 160. He carried about 30 extra pounds, most of it in his belly, and he was on 3 different medications that left him feeling tired and foggy all the time. He told me, "Doc, I just want to feel like myself again." We started him on the sage protocol. 2 cups of tea a day, before lunch and dinner. We didn't change his diet dramatically, just cut back on the obvious stuff like soda and dropped the bedtime snacks. After 4 weeks, his fasting blood sugar had dropped by 40 points. After 10 weeks, his A1C came down to 7.1. After 6 months, with continued use of sage and some moderate walking that he started doing because he had more energy, his A1C was 6.3, his LDL was down to 118, and he had lost 22 pounds. His own doctor cut his diabetes medication in half. Frank told me he hasn't felt this good since his 50s. That's not a miracle, that's biochemistry, and it's repeatable. I've seen versions of Frank's story play out in my clinic dozens of times over the years. Now I want to address something that I think is really important, especially for you guys watching this who are skeptical, because I respect skeptics. I am one. The research on sage for metabolic health isn't fringe science. There have been multiple peer-reviewed studies published in journals like Complementary Therapies in Medicine and the journal Phytomedicine. Iranian researchers in particular have done some of the most rigorous work in this area with double-blind, placebo-controlled trials that meet the gold standard of medical evidence. If you want to look it up yourself, search for sage extract clinical trial type 2 diabetes, and you'll find the studies. I want you to verify what I'm telling you. That's how you build real trust. Here's what you can realistically expect when you start the SAGE protocol. In the first 2 to 3 weeks, you'll start noticing better blood sugar readings if you test at home. If you don't test, you might notice that you're not getting that mid-afternoon energy crash anymore, or that the sweet cravings have backed off. By week 4 to 6, your cholesterol numbers should start shifting in the right direction, but you'll need a blood test to confirm it. And the belly fat, that's the slowest one to move. Expect significant changes around week 8 to 12. The visceral fat starts coming off first, even before you see a big change on the scale, because visceral fat is metabolically active and responds to insulin sensitivity, changes faster than the subcutaneous fat under your skin. Now, I mentioned at the start of this video that there was one leaf that outperformed all the others, and that's sage. But I want to be straight with you, because the comments on videos like this always bring up this point, and rightly so. There are several other leaves that have real scientific backing and can be used alongside sage or rotated with it for variety. Let me run through the short list because I know some of you are going to ask. Olive leaf is fantastic for blood pressure and has secondary benefits for blood sugar. Mulberry leaf is one of the best for blunting blood sugar spikes after meals, and the Japanese have been using it for centuries. Bay leaf, the same stuff in your spice rack, has been shown to reduce both glucose and cholesterol when taken as a tea over several weeks. Moringa leaf is a powerhouse from Africa and South Asia that's loaded with nutrients and has anti-diabetic effects. Oregano, which I know I've talked about in other videos, is excellent for inflammation and gut health, both of which influence metabolism. And rosemary, which is in the same family as sage, has overlapping benefits and tastes wonderful. But if I had to pick one, just one, to start with for a man over 60 dealing with the trifecta of high blood sugar, high cholesterol, and stubborn belly fat, I'd pick sage every single time. The combination of effects, the safety profile, the affordability, and the ease of preparation make it the clear winner in my book. Let me give you a few practical tips for actually sticking with this protocol, because I've learned the hard way that even the best advice doesn't help anybody if they can't follow through with it. First, buy a small electric kettle if you don't already have one. Makes the whole process take about 3 minutes instead of 10. Second, get yourself a nice mug that you actually enjoy drinking out of. Sounds silly, but rituals matter. Third, prep your sage in a small jar with a tight lid so it stays fresh, and keep it on your counter where you can see it. Out of sight, out of mind. Fourth, set a timer on your phone for 30 minutes before lunch and dinner. That's your cue to put the kettle on. A quick note about combining sage with medications. If you're on metformin or any other diabetes medication, sage can enhance the effect, which means your blood sugar might drop lower than usual. That's a good thing in the long run, but in the short run, you need to monitor it carefully and talk to your doctor about possibly reducing your medication dose as your numbers improve. Same goes for blood pressure medications and statins. Sage isn't going to interact dangerously with any of them, but the combined effect might be stronger than you expect. So go slow, monitor your numbers, and stay in touch with your doc. I also want to mention who shouldn't use sage. If you have epilepsy or a seizure disorder, talk to your neurologist first. Pregnant or nursing women should avoid medicinal doses, but I'm guessing that's not too relevant for the men watching this video. If you're scheduled for surgery in the next 2 weeks, stop taking sage because it can interact with anesthesia. And if you have any kind of hormone-sensitive condition, check with your doctor because sage has mild estrogen-like effects in very high doses. Look, I know there's a lot of noise out there. Every week there is some new miracle herb, some new superfood, some new diet trend. I get it, the skepticism is healthy, but I've spent 15 years in clinical practice, and I'll tell you that the things that actually work, the things that produce lasting change, are usually the simple things that have been around for a long time. Sage has been used medicinally for over 2,000 years. The Romans considered it sacred. Medieval Europeans called it the herb of immortality. Native American traditions use it for cleansing and healing. There's wisdom in that long history, and modern science is finally catching up and explaining why these traditions worked. If you take one thing away from this video, let it be this. Dimasavisis. You don't have to feel powerless about your blood sugar, your cholesterol, or your belly fat. You don't have to accept that decline is inevitable just because you've crossed 60. The tools are out there, and many of them are remarkably simple and affordable. A bag of dried sage costs about $3. An electric kettle is a one-time investment. The protocol takes about 5 minutes a day to follow. That's a tiny investment for what could be a massive return on your health. Start tomorrow morning. Don't wait. Don't tell yourself you'll get to it next week. Pick up some sage on your next grocery run, or order it online tonight, and start the protocol the day it arrives. Track your numbers if you can. Pay attention to how you feel. Give it the full 12 weeks before you make any judgments, because the deeper changes, the cholesterol shifts, and the belly fat reduction take time to show up. I want to hear from you. Drop a comment below and tell me where you're watching from. And let me know if you've ever tried sage or any other medicinal herb for your health. If you have questions about the protocol, ask them in the comments, and I'll do my best to answer as many as I can in future videos. If this video helped you, hit that like button and subscribe so I can keep showing up in your feed with more practical, evidence-based health information for men over 60. I've got a video coming up next week where I'm going to do a deep dive on olive leaf and how it specifically helps with blood pressure and cardiovascular health, which I know is a major concern for a lot of you. So make sure you're subscribed and you've got the notification bell turned on so you don't miss it. Take care of yourselves, gentlemen. You've earned the right to feel good in your own body, and there's still so much life ahead of you. I'll see you in the next video.